There is one sentence that can instantly make even the calmest patient nervous. Your blood reports are concerning. I think we should do a bone marrow biopsy. The moment patient hears these words, I often see the same reaction. Their eyes wide open, they become silent, and then comes the question, Doctor, is it going to be very painful? Over the years, I have learned that most patients are not actually afraid of the procedure. They are afraid of what they imagine the procedures will be. Today, I want to remove that fear. I am Dr. Ganesh Jaishetwar, Senior Consultant Hematologist and Bone Marrow Transplant Specialist. And I want to walk you through exactly what happens during a bone marrow biopsy. No myths, no internet horror stories, just facts. First, let's answer the most important question. Why do we even perform a bone marrow biopsy? Think of your bone marrow as the factory that produces blood cells. Every red blood cell, every white blood cell, and every platelet. They all begin there. When blood reports become abnormal, sometimes the only way to understand what's happening is to examine the factory itself. A bone marrow biopsy gives us that information. It helps diagnose conditions such as leukemia, lymphoma, myeloma, unexplained anemia, abnormal blood counts, and many other blood disorders. In many situations, it provides answers that no blood test can provide. Now, let's discuss what actually happens. One of the biggest myths is that we take the sample from the spine. We do not. In most adults, the sample is taken from the back part of the hip bone. This area is safe, accessible, and ideal for obtaining the information we need. The patient usually lies comfortably on their side or stomach. The skin is cleaned thoroughly. Then we administer the local anesthesia, and this is the most important step. The area becomes numb, and this dramatically reduces the discomfort during the procedure. Patients often ask, will I feel anything? The honest answer is yes. You may feel pressure, you may feel a pulling sensation, you may feel brief discomfort when the marrow sample is collected. But what most patients tell me after is, Doctor, it wasn't nearly as bad as I imagined. That sentence is something I hear repeatedly. The procedure itself is usually completed within minutes. Once the sample is collected, a small dressing is applied, no major stitches, no prolonged recovery, and most patients are able to go home the same day. Now let's address another fear. Can a bone marrow biopsy damage the spine? Absolutely no. Can it cause paralysis? No. These are among the most common misconceptions I encounter. When performed by a trained specialist using standard techniques, bone marrow biopsy is a routine procedure performed worldwide every day. Like any medical procedure, there are potential risks, minor soreness, temporary discomfort, occasional bruising, but serious complications are uncommon. What concerns me far more than the biopsy itself is when patients delay it. Sometimes people spend weeks or months avoiding the procedure because they are frightened. Meanwhile, the underlying disease continues progressing, and unfortunately, that delay can be far more harmful than the test. I often tell my patients, the biopsy is not the problem. The biopsy is the path to answer. Once we know exactly what's happening inside the bone marrow, we can create the right treatment plan. And in modern hematology, precision matters. Today, we use sophisticated laboratory techniques to analyze bone marrow samples, morphology, flow cytometry, cytogenetics, molecular testings. These tools help us understand diseases at a level that was impossible a generation ago. That information directly influences treatment decisions and outcomes. So if your hematologist has recommended a bone marrow biopsy, I want you to remember one thing. Fear often comes from uncertainty. Once we understand the procedure, most of that fear disappears. The test is temporary. The information it provides can be life-changing. And sometimes obtaining the correct diagnosis is the most important step towards recovery. recovery. Thank you for watching. If you are scheduled for a bone marrow biopsy and have questions, leave them in the comments below. I will try to answer as many as possible. Take care, stay informed, and I shall see you in my next video. Thank you.